countries present, all other invitees present from the Ministry of Education, Guyana, Ministry of Health, Guyana, and Clinical Services, Guyana, private sector, and civil society reps, Guyana, to a special category of EPI managers in the room, and 4 generations of MCH officers present here today. Dr. Harris, including myself, Dr. Hamilton, Dr. Wolford, and finally, to students, members of the public, media, welcome to this special launch of Vaccination Week in the Caribbean and in Guyana, to the launch of the Immunization Month of Guyana, to the launch of the first annual campaign in Guyana. It gives me great pleasure to introduce our chairperson for today, who will walk us through the themes and the history, and who will share with you a wealth of presenters to help you understand why it is important that we're all gathered here today in a historic celebration on the progress made through immunization. Dr. Ertenisa Hamilton is our Director of Primary Healthcare Services in the Ministry of Health, and I'm happy to pass the floor on to her. My name, by the way, is Onika Scott. Welcome, Dr. Hamilton.
Good morning. Standing on all protocols observed, I'm very happy to be your chairwoman for this morning's event. Now, every year we come and we speak about one of the most important topics that we can speak about in Guyana, and that is vaccination. Why do we vaccinate? Because we have to protect those that we love. And I'm 100% certain, 100%, that everybody sitting in this room would have been vaccinated. Am I correct? Am I correct? And look at the bright smiles, look at the animation in the room. That tells you something. Vaccination protects and it allows you to enjoy this thing that we call life. So, what is this year's theme? We are working under the theme that your decision makes a difference. Prevention is protection. So we need to vaccinate now. This story about Vaccination Week in the Americas didn't start yesterday. It started over 24 years ago. Why? Because within the Americas, we had an outbreak, a very serious outbreak of measles. And because of that outbreak, there were a few countries that thought that if we were to work together, we have an opportunity to really come at this thing and to really protect the people that we love. And so, the ministers from the regions in the Americas, specifically Colombia and Venezuela, came together as 2 countries who live next to each other, and they started this Vaccination Week. And because the thing was so good, it caught on. Then we had Vaccination Week in the Americas. And at this point in time, there's actually Vaccination Week happening in the entire world because of those 2 ministers that recognize that there is solidarity in unity, that good neighbors protect each other. And so Guyana joins the rest of the Caribbean this morning and the Americas to speak on the topic of solidarity through vaccination. So with that, I once again say welcome to you, and I hope that the little bits that you will hear coming out from this morning's program reminds you of the decision to ensure that each one will reach one with the message on vaccination. So with that, I now invite remarks from our representative from CARICOM.
Anthony, Honorable Minister of Health, Guyana, Dr. Rhonda Seeley Thomas, Assistant Director, PAHO, and other PAHO officials, representatives of other institutions, Dr. Latencia Hamilton, Primary Healthcare Director, representatives from the Ministry of Health, other invitees, good morning.
Good morning.
I am delighted to offer remarks at this auspicious event and bring greetings from Dr. Carla Barnett, our Secretary General, who could not be here with us today, but she sent greetings and best wishes for this event. Profound thanks to the Pan American Health Organization Guyana office for its invitation to this significant Caribbean launch. Today we join the rest of the Caribbean and the Americas, celebrating the 24th Vaccination Week in the Americas under the theme, Your Decision Makes a Difference. This theme is highly relevant and timely. The choice of Guyana for this launch is particularly fitting as Guyana has made significant progress in immunization status because of its robust immunization system. The Pan American Health Organization has recently commended Guyana's remarkable health transformation, noting that the country's leadership in immunization serves as a model for the region. Today's launch attests to a renewal of our regional commitment and also our collective responsibility to protect every Caribbean citizen. Our presence here also signals that our region is firmly anchored in the 2023 Declaration of Nassau. Through that historic commitment, our ministers of health signaled that immunization must remain central to our political and development agendas. The region is moving with precision because of our collective actions. We take great pride in our legacy. The Americas was the first region in the world to eliminate smallpox and poliomyelitis. Within our Caribbean community, we have reached even more extraordinary milestones, having successfully eliminated many vaccine-preventable diseases to include diphtheria, congenital rubella syndrome, and rubella. Across our community, we continue to see specific record-breaking milestones. Jamaica was recently honored with the Powell Henry C. Smith Award for the most improved immunization coverage in the Caribbean. Guyana has moved decisively to modernize its defenses, becoming one of the first in the region in 2025 to introduce the 9-valent HPV vaccine for broader cervical cancer protection, alongside the launch of its first seasonal influenza vaccine. Member states across the region continue to strengthen primary healthcare systems and support the EPI managers and medical professionals who go beyond the call of duty to reach every child. However, we cannot rest on yesterday's victories. Notwithstanding successes on many fronts, we must be honest about the risk we face. We are currently witnessing a worrying surge in measles across the wider region, a stark reminder that our progress can be reversed if our vigilance declines. In an interconnected world, health threats do not respect borders. Our greatest challenge is no longer just the availability of vaccines, but the infodemic of misinformation. When a parent hesitates, it affects the collective safety of our schools and communities. This is precisely why every decision matters. The PAHO technical teams, the strategic advisory group, and our dedicated national EPI managers continue to provide the leadership and data-driven guidance needed to advance these initiatives. We look forward to our continued relationship and collaboration, particularly through the Caribbean Immunization Technical Advisory Group. This ensures that our decisions are technically sound and operationally grounded. Guyana's work in the cross-border vaccination with Brazil and Suriname provides a practical example of regional cooperation in action. By aligning our health strategies at the border, we move closer to a true community of immunity that protects the entire Caribbean community. Ladies and gentlemen, boys and girls, I want to reiterate that we all have a role to play. This year's theme reminds us that every decision makes a difference. With continued collaboration among governments, technical advisors, and frontline health workers, we will secure a healthier future for all. I wish you a successful and impactful vaccination week. Thank you.
Thank you very much for those remarks, Ms. Royer. There were a few very important things that came out. Who makes this vaccination really happen? Is it the health workers only? No. Is it the parents only? No. We have enough history and we have enough evidence that allows us to see that vaccination is a partnership between the government and its people, between the Ministry of Health through its health workers and the parents and the communities. Because guess what? We need to make sure that the grandparents are happy so that they could tell the parents, yes, it is good. We need to make sure that the gatekeepers of the communities are happy so that we can go and vaccinate. And for every health worker sitting here, we know that this thing doesn't start when the baby is born. We start this conversation from pregnancy, and it continues throughout that period. So when the baby is born and starts as early as the first dose, and now we have 2 doses, the BCG and the hepatitis B birth dose that are given at birth. So this conversation starts way before. And we can say that our partnership in Guyana is working. Why is it working? Because we have the evidence. We have the evidence that allows us to see that for our under 5 coverage, for most of our vaccines, we have a 90% coverage and over. Coverages that are as much as 100% in some cases. And we must give ourselves a round of applause. And this is what partnerships look like. Partnerships allows us to see successes. And so as we continue the each one reach one, it is still a team effort. And in keeping with the theme of a team effort, we now invite our colleagues from the Ministry of Culture who are here through the National Dance School to provide us with a cultural item. Let us introduce them with a warm round of applause. My apologies, the National Dance Company. Can we give them another round of applause? We see culture, and in Guyana, vaccination has now become a part of our culture. I can tell you that for a fact. If you ever have the opportunity to walk by a clinic, you're going to understand what I'm talking about. We don't just wait until 8 o'clock. We are there from 6 o'clock, from 7 o'clock, because you learned it from your mother and your grandmother, and everybody knows that the child has to be vaccinated. You cannot tell us that the child isn't vaccinated. So it has now become a part of our culture. And as I look across, and if we all look, which would be my left, and your right, you're going to see that we have the Ministry of Education well represented. Why? Because as I said, this is a partnership. And we have CEO here. And CEO can attest to the fact that the vaccination conversation is ongoing. We are now working on ensuring that HPV is very present for all of our children from 9 onwards. Because guess what? We are really working on ensuring that the population isn't just protected, but that our children will survive and they will thrive in what we now have as an economy that is just booming. So everybody has to be a part of this. And so with our HPV, we're ensuring that cervical cancer does not have a hold on our population. Now, as we continue in the program along the lines of partnership, let us invite Dr. Kim Ava Dixon to give us a little introduction about this EPI success story that Guyana boasts about, that the Caribbean boasts about, that the Americas boast about. So that when you're leaving here today, if CEO decides that he's setting an exam at the end of this year and he's asked something about vaccination, that the children knows what they're talking about, right? Good. I just give him an idea. Let's invite Dr. Dixon to speak to us on the successes.
You're correct. Dr. Frank Anthony, Dr. Seeley Thomas, please allow me to stand on existing protocols, because mine is a really simple task today. It's just to introduce a video that will tell you the story about vaccination in Guyana. So it's not for me to tell the story, but we have a video that's going to tell you the story. What I would like to say is I really want to thank you all for coming out on a Saturday, especially the school children. Boys and girls, you came out bright and in your uniforms. Thank you for coming, and say thanks to your parents too. And I just want to say that PAHO WHO is so pleased to be associated with such a successful and dynamic program such as EPI here in Guyana. We have actually supported and worked with the program since the 1970s. We have supported many areas of surveillance, data monitoring, cold chain strengthening, capacity building, different areas, and we are pleased that that this program is so successful. And so what we have now is a little video that is going to tell you a bit about how the vaccination and EPI has evolved over the years. I also want to thank Guyana. They've also been procuring all their vaccinations from PAHO's revolving fund. And that also, we are very pleased to be able to partner on that particular aspect. So let me leave it there, and you'll hear and see for yourself how vaccination has evolved. Thank you.
The expanded program on immunization began in Guyana in the 1970s, protecting children from deadly diseases. Guyana's immunization journey expanded steadily, Milestones include polio, VPT, VT, and TB in the 1970s, MMR in 1995, hepatitis B in 1998, yellow fever in 1999, pentavalent in 2000 to 2001, meningococcal in 2005, PCV7 in 2009, rotavirus in 2010, PCV13 in 2011, HPV in 2012, expanded to boys and girls in 2017, COVID-19 in 2020, and Influenza Plus HPV9 in 2025. By 2026, Guyana will be protected against 21 diseases.
Being part of the immunization program is both an honor and a privilege to be a part. We are seeing children that are healthier, less hospitalization.
The program grew from childhood immunization to protecting adolescents, adults, and families in the early 2000s. Our motto, not a child or family left unvaccinated. Coverage of 95% nationwide over the last 5 years in the targeted population.
My message to parents is ask all the questions you can ask. Be informed, don't be scared. Most times, you're scared of what was going to happen to your child, how you're going to manage your child being in pain as some parents, or we can bear seeing them cry, but it is something for them in the long run. Myself and family be vaccinated, and I hope you get informed and have your family vaccinated.
Guyana has been polio-free since 1962, measles-free since 1991, and neonatal tetanus eliminated for over 20 years. Sporadic yellow fever cases were contained. Surveillance ensures continued safety. Vaccines save lives. Guyana's expanded program on immunization is a success story of resilience, innovation, and commitment.
Because vaccines do work, they help to prevent our children, our nations at large from vaccines-preventable diseases.
Congratulations, Guyana.
Thank you very much, Dr. Kim Dixon. And listen, forgive me, I wanted to cause a confusion this morning, changing up the program. But you will have to understand that I'm very passionate about vaccination, and I get carried away sometimes, right? So forgive me. So, in keeping with the spirit of understanding that vaccination goes beyond borders, we also want to invite Dr. Karen Brooms, who comes to us all the way from the beautiful island of Barbados, to tell us a little bit about the successes beyond the borders of Guyana to what happens in the rest of the Caribbean. Because guess what? You know just how they say that diseases knows no borders? Vaccination knows no borders. And if you're in Guyana, you know that regardless of the country you come from, we have vaccines available for you free of cost. So let's invite Dr. Brooms with a warm round of applause.
Protocol having been established, distinguished guests, PAHO colleagues, ministry partners, members of the public, boys and girls, good morning. This morning, it is my utmost pleasure to launch two much-needed initiatives for the Caribbean: the Immunization Manual, a Caribbean template, and phase 1 of our new Caribbean cervical cancer prevention campaign, and it is called In My Hands. Let me start with the Immunization Manual, and this is a 2026 edition, so it is hot off the press. This manual is built for the reality of every national immunization program in the Caribbean. It brings together in one place everything related to the expanded program on immunization. It also reflects something we sometimes take for granted, that immunization is not only about children, it is about protection across the life course. It is adolescents receiving HPV vaccines to safeguard their future, pregnant women protecting themselves and their babies, healthcare workers shielding themselves from communicable diseases, and older persons protecting themselves in their golden years. This manual helps us to deliver this consistently. Special thanks to Ms. Chisa Cumberbatch, PAHO consultant, and of course, Dr. Beryl Irons, a member of the Caribbean Technical Advisory Group on Immunization, who have led the development of this manual, and to the many EPI managers and practitioners across the Caribbean whose real-world experience shaped its content. Because you will recognize yourselves in this document. You will see the systems you have built, the challenges you have worked through, and the solutions you've developed, often with limited resources, but with strong commitment. For me, this is what makes this manual different. It is not theoretical, it is practical. And that is how we do it in the Caribbean. We are practical. And it reflects how the immunization program is practiced in our region. It gives us something we don't always have, a shared standard across all countries. As we mark Vaccination Week in the Americas under the theme, Your Decision Makes a Difference, this manual supports those decisions, the ones made every day by healthcare workers, program managers, and policymakers. Those decisions are what sustain our progress. So my ask for this manual is simple. Use this manual, train with it, adapt it, and let it support your team. Because the strength of our immunization programs will always depend on how well we translate guidance into practice. And that is something the Caribbean has consistently shown that it can do. And we have seen that consistency here in that video with Guyana. So a round of applause again for you in Guyana. Consistent practice. Now, let's move on to our new communication campaign. Today, we place the future of Caribbean children exactly where it belongs, in our hands. Today, we launch phase 1 of our Caribbean cervical cancer prevention campaign, and as I've said, it is called In My Hands. This title reflects reality across our region. Every day, decisions about vaccination happen in homes, in clinics, in conversations between parents, caregivers, and healthcare workers. In those moments, the future of a child sits in someone's hands. That is what this campaign captures so powerfully. You see it in the visuals, children held safely in open hands, futures imagined, protected, and supported. Children who can grow, travel, and thrive, young people chasing their goals, children stepping confidently into their future. Protection is personal, protection is immediate, protection is in our hands. And why does this matter? Across the Americas, cervical cancer takes more than 40,000 lives every year. In our region, women are 3 times more likely to die from this disease than in North America. This is a cancer we can prevent. We have safe, effective vaccines. Vaccinating girls before age 15 offers the strongest protection. Decisions about HPV vaccine are shaped by more than information. They are shaped by gender norms, by expectations around who should receive a vaccine and why. They are shaped by concerns about safety, by misinformation, by religious and cultural beliefs, and by discomfort around conversations about health and sexuality. Many parents and caregivers will lack clear, trusted information about the link between HPV and cancer. So this campaign does something deliberate. It confronts those realities. It affirms that the HPV vaccine supports health and protection of children and adolescents across our regions. It dispels myths, and it brings those messages into everyday Caribbean spaces through radio, through social media, through video storytelling, and through print materials designed for adaptation across countries and communities. Research shows that vaccine decisions are influenced by deeply rooted social norms around gender, religion, trust, and lived experience. And we still need deeper understanding of what drives acceptance. So as we move forward, we must invest in Caribbean-led, context-specific research to better understand these dynamics, to understand and examine how norms and power shape decision-making, and to design responses grounded in our realities. Because if the future is in our hands, then understanding those hands, those decisions, and those contexts must also be a priority. Before I close, I want to recognize the people behind this campaign. To a magnificent creative team, thank you for bringing this vision to life in bold, relatable, and unmistakably Caribbean ways. To my colleagues, Dr. Gloria Giraldo, Advisor for Non-Communicable Diseases and Mental Health, Mrs. Lisa Bailey, Communications for Health Promotion, and Ms. Ave LeBlanc, International PAHO Consultant with the Caribbean Region Sub-Regional Office. Thank you very much for your technical and creative insights, as well as your commitment. And to my colleagues in Comprehensive Immunization PAHO, thank you for your technical guidance, feedback, and collaboration. This campaign reflects all of you. So today, as we launch In My Hands, I invite all of us to use it, to adapt it, to bring it into our communities, and to remember what it represents. Every decision we make as parents, as healthcare workers, as leaders, holds power to protect life. The future is here. The future is in our hands. Thank you. And I now leave you with a video presentation for VWA and the campaign In Our Hands.
When our world became threatened by invisible foes, our region united to reach the unreached, to protect the most vulnerable. Now we're reflecting on the triumphs of togetherness, a celebration of Vaccination Week in the Americas. The relentless dedication and passion of a few have inspired change, restored hope, and saved the lives of thousands. We leveraged creative communication channels to improve vaccination awareness and education, connecting with audiences through social media and evolving how we reach the vulnerable with dynamic mobile clinics. We witnessed true community spirit with positive responses to our health fairs, community vaccination drives, and school outreach programs. We harness the power of collaboration, using specialized training sessions to help build capacity and strengthen capabilities of our public healthcare networks. And we achieved all of this working as one. From the northern reaches of Bermuda to the southern tip of Guyana, we saw a region stand together, support each other, and grow stronger. By solidifying our commitment to excellence in immunization efforts, we have set a firm foundation to safeguard current and future generations. Thanks to our united efforts, thousands of lives were positively impacted in 22 countries across the region. This is the power of Vaccination Week in the Americas. Let's keep building a stronger future for healthcare.
Her plans to achieve her dreams is an eye Her desire to accomplish her goals is in my hands. Her hope of living life to the fullest is in my hands. Cervical cancer caused by human papillomavirus infections is a leading cause of death among women. By giving my daughter the HPV vaccine before the age of 15, I'm protecting her from life. It's safe and effective because her future is in my hands. Hey Maya, let's chat about something important.
Sure, Auntie Marcia.
It's about cervical cancer.
That sounds serious.
It's a leading cause of death among women.
Really?
Yes, it's usually caused by HPV, and even girls under 15 can get an HPV infection.
Wait, I'm 13.
Don't worry, dear. We can protect you with the HPV vaccine.
Are vaccines safe?
Yes, the HPV vaccine has been proven to be safe and very effective.
Great, I want to get vaccinated then. I've got big dreams to achieve.
That's my girl. Every daughter has dreams. Let's protect them from cervical cancer. What do you get when you bring together 3 years of risk communication and community engagement training, real-life insights on Caribbean vaccination initiatives, and valuable feedback from experienced healthcare professionals in 22 countries? You get the Vaccination Companion, an essential new resource that empowers healthcare professionals on the front line. This compact, user-friendly guide offers evidence-informed knowledge aligned with current vaccination learnings and priorities. It includes frequently asked questions and suggested discussion points healthcare workers are likely to encounter. It offers practical, relevant information and culturally sensitive communication tips, all specifically created with a Caribbean context in mind. This is more than a book. It's a highly specialized tool, a first of its kind for the region, and it represents the amazing strides we continue to make in our vaccination efforts. And of course, its portability and durability are ideal for use in real-world healthcare settings. Empower yourself with the knowledge to protect our communities with the Vaccination Companion. Your country will receive copies from the Caribbean Sub-Regional Program Coordination.
We can give a much more resounding round of applause for that. The decision remains ours, individually and as a collective, to ensure that vaccination provides the protection. Please allow me to welcome the UN Resident Coordinator that is with us this morning. Please allow me to also welcome our FAO representative that is with us this morning, and our member from the ICC Guyana that is sitting with us here this morning also. So as we continue our program, we were given a lot to think about with the videos that we saw, looking at the success story of vaccination in Guyana and the success story of vaccination in the Caribbean. And there are a few things that we can clearly say that stands out still, that it continues to be a partnership, that it continues to be one of the foundations of our healthcare system, and we have the evidence to see that vaccination continues to be public health's most successful story to date. So allow me to welcome our next item, which will allow us to mellow in and think a little bit about what we just saw. So can we have our instrumentalists take the floor for a few minutes? our ears. Thank you very, very much for that. Now, we have a drum roll moment. If you look on your program, you're going to see that the next item, we will be providing some awards. Now let me tell you a little bit about these awards. Every year we give awards at our national EPI meeting, in which we look at the performance over the years. And so we give awards to regions for their good performance. We give awards to some of the healthcare workers. But within those healthcare workers, that most of which we may not see, there are a few gems. There are a few gems that are within our healthcare system. And we wanted this morning to recognize a few of our gems. Why? These women, unfortunately, there are no men on the list, but these women would have been the real backbone of this immunization program. And why I say that? We will be awarding plaques and prizes of excellence to 6 healthcare workers who have provided us with over 30 years of service. Within this room, we have a healthcare worker that is still working with us, that has worked with us in the immunization program for 41 years. "41 years is almost my age." So she has been working at this for my age. And there is no weight, and it would have all come from the fact that there were women sitting in this room who made it their duty to ensure that those individuals didn't just survive, but that they had an opportunity to thrive. Please, let's give a resounding round of applause. I will invite Dr. Anthony to present the award to our healthcare worker that has served us diligently for 41 years. Can we stand and call Nurse Trevlyn Mason to the stage to collect her award? Please, let's give her a round of applause. And this is what serving with excellence looks like. And I must add, it is 41 years and counting. Thank you very much. You may be seated, Minister. Don't move as yet. We are moving down from 4 to 1. And we have another person who would have served us diligently for 45 years. Do we have Nurse Josephine Murphy from region number 7? And sorry, I made you sit, but sorry. Please, let us give Nurse Josephine another round of applause and a standing ovation for 45 years of service. And I'm adding, and still counting. These women are still in the system, working and mentoring health workers as we stand in 2026. Please, a round of applause. Thank you very much for your service, Nurse Murphy. please be seated? And you will remain seated for now. Can we please invite Dr. Seeley to the stage? And as we invite Dr. Seeley, please let us also give a resounding round of applause for Nurse Wendy Lillian. Nurse Wendy Lillian. Come on, louder. Nurse Wendy has been serving the Ministry of Health for 39 years of service and still serving. One more award, Dr. Seeley. Can we please call to the stage Nurse Deborah Henry of the MCH department, who has been with us for 37 years and counting, and is the real champion of what immunization looks like. Round of applause to Nurse Henry, please. This is our immunization warrior in the flesh. Come on. Where is she? Thank you very much, Dr. Seeley. We invite Dr. Karen Brooms tap in to the stage. We're still going. Minister just did the numbers. With the amount of service here, we have how much? 264 years as an addition if you're putting all of it together. Can we please ask Nurse Dawn Bagot? Nurse Dawn? Round of applause to Nurse Dawn. This beautiful lady here that has been with us for 37 years also. Another round of applause. Let's go, let's go. We have one more to come, but before we do that, we have Nurse Diane Sandy from Region Number 2. She's not with us, but she would have served for 35 years. And finally, we have Nurse Doreen Alfie, who is with us, who has served for 30 years from Region 6. Let the applause continue. Thank you very much. Please, thank you very much, ladies, for your service. And this, I must say, besides the vaccination coverage and the lack of actual vaccine preventable disease outbreaks. This is what our real success story is about. The dedication, the tears, and the energy and the love for what you do. This is what it looks like. So we now invite Dr. Rhonda Seeley Thomas, our PAHO Assistant Director, to provide us with remarks and to launch the Caribbean Vaccination Week of the Americas. Dr. Thomas, Seeley Thomas.
Thank you, Dr. Hamilton, and allow me to stand on the protocols that have already been established, but to especially recognize Dr. Frank Anthony, the Minister of Health of Guyana, Ms. Helen Royer from the CARICOM Secretariat, other PAHO representatives, UN representatives, colleagues, ladies and gentlemen, good morning.
Good morning.
It's a joy and honor to be here with you in Georgetown, a place that embodies warmth, resilience, and generosity that defines our Caribbean family. Guyana has once again welcomed me as the Assistant Director of PAHO with open arms. On behalf of our Director, Dr. Jarbas Barbosa, I wish to express our sincere appreciation to you, Minister Dr. Frank Anthony, for your gracious hospitality and for agreeing to host the sub-regional launch of Vaccination Week in the Americas 2026 here in Guyana. I think that PAHO really made a very good decision in choosing Guyana. As you have seen, they've progressed over the years, and they have a cadre of healthcare workers who are really dedicated to vaccination, and I'm really honored. I was surprised. I didn't know that this recognition of these healthcare workers was going to take place this morning, but I'm very honored to have been part of that celebration, and I want to once again congratulate all of you for your hard work. Just to add as well that it's especially meaningful for me as a person from the Caribbean to stand among colleagues and partners. Guyana is home, not only in a geographic sense, but in our shared values, resilience, and our collective commitment to protecting the health of our people. Vaccination Week in the Americas, as you would have heard, was started 24 years ago with the primary objective of strengthening immunization programs because of an outbreak of measles. And I'll tell you more, because as I stand here, we're also experiencing an outbreak of measles in the Americas right now, and I'll tell you more about that. And Vaccination Week is really to focus on reaching persons in vulnerability and those with limited access to health services, in particular populations in border and rural areas, urban hemispheres, and indigenous communities and other high-risk groups. So again, it's very fitting that we're celebrating Vaccination Week in the Americas, or launching it here for the sub-region in Guyana, because you have vulnerable populations, you have persons living in border populations as well. Our theme, Your Decision Makes a Difference, underscores that the role that each one of us plays. Every policy decision, every clinical interaction, and every conversation with a parent contributes to stronger immunization systems and healthier communities. This year, Vaccination Week in the Americas is strategically aligned with PAHO's Disease Elimination Initiative, where we are seeking to eliminate more than 30 communicable diseases and related conditions by 2030. And these include 11 vaccine-preventable diseases. 5 of these, polio, measles, rubella, congenital rubella syndrome, and maternal tetanus, have already been eliminated in the Caribbean. This accomplishment underscores what is possible when science, political commitment, and a dedicated public health workforce are brought together in support of a common goal. Across the Caribbean, we are also seeing steady progress beyond elimination milestones. Polio-3 coverage has increased from 92% in 2022 to 95% in 2025, meeting the regional target, with countries such as Guyana, Montserrat, and St. Vincent and the Grenadines achieving 100% coverage. Measles, mumps, and rubella 1 coverage remains stable at 93%, while measles, mumps, and rubella 2 coverage has improved but continues to lag at 87%. For those of you who are not in the vaccination immunization field, we want to get 100% coverage in our target populations, but we really know that sometimes it's not possible to reach 100%, so we really aim for 95% coverage, where we have what we call herd immunity that protects those who are unvaccinated. We've also strengthened surveillance systems. So for example, when we vaccinate against measles, we don't just vaccinate and assume that persons would not get the disease. We do have surveillance for fever and rash so that we can detect cases early and take necessary measures and make sure that the disease is not reintroduced. In the Caribbean, rash and fever surveillance notification rate reached 6.666 discarded cases per 100,000 population in 2025, well above the global target of 2. So in the Caribbean, we are doing very well with regard to surveillance. And this reflects improved detection and reporting across the sub-region, including Guyana. At the same time, gaps in acute flaccid paralysis surveillance, which helps us to detect cases of polio early, highlights that we cannot be complacent and that continued investment and vigilance remains essential. We are also making progress in the introduction of new vaccines that you would have seen in the video for Guyana and in strengthened immunization systems. Pneumococcal vaccines and rotavirus vaccines have most recently been introduced in Grenada and St. Vincent and the Grenadines, with Jamaica preparing for introduction in 2026. In parallel, countries are also strengthening their immunization system to the adaptation of new tools and guidelines, including the EPI self-assessment using PAHO-developed monitoring framework. PAHO will continue to support Caribbean countries with technical guidelines and model Caribbean EPI legislation and the Caribbean EPI template manual. However, despite our successes in the Caribbean, we must acknowledge that important challenges persist, such as decline in vaccination coverage and outbreaks of vaccine-preventable diseases. HPV vaccine coverage in particular continues to vary across the Caribbean, and vaccine hesitancy and misinformation remain a concern. We know that trust is critical. When parents and caregivers receive guidance from a trusted source, and when healthcare workers are confident and well-informed, vaccine uptake improves. These challenges are not abstract. They are visible in the current epidemiological trends across the region. Since November 2024, countries across the Americas have experienced a rise in measles cases. What began as an outbreak in Canada subsequently spread to the United States and Mexico in 2025, before extending to several countries in Central and South America. By November 2025, Canada has been declared endemic for measles by PAHO, and as a result, the region of the Americas unfortunately lost its measles elimination status. This is concerning. In 2025, a total of 14,767 cases of measles were reported in the Americas, more than 30 times higher than in 2024. And alarmingly, in just the first 4.5 months of 2026, cases have already surpassed the 2025 total, reaching 15,366. In 2025, hospitalizations made up 13% of reported cases of measles, and there were 43 deaths, unfortunately, across 2025 and 2026. One of the principal drivers behind the measles outbreak now remains unchanged, and that is pockets of underserved populations with gaps in immunization coverage, highlighting the fact that coverage is important, not only for measles, but for all other vaccine-preventable diseases. Taken together, these trends confirm that measles is a serious public health threat that we cannot afford to ignore. The situation is a strong reminder of the importance of safeguarding the progress achieved and of maintaining high vaccination coverage to prevent illness, death, and broader societal deprivation. In the Caribbean, where cases have been identified, countries have responded swiftly and effectively to contain and maintain both imported and related cases. This reflects strong coordination, robust preparedness, and a clear commitment to protecting the health of populations. This is another example of Caribbean excellence, resilience, and showing that when challenges arise, we act decisively and collectively. The progress we have made is meaningful, but much more remains to be done, including achieving and sustaining, as I said, at least 95% coverage for all antigens of vaccine-preventable diseases, addressing persistent gaps in MMR2 coverage, strengthening surveillance systems, and investing in health information systems, including electronic immunization registries, which would support timely, evidence-based decision-making. Sustained progress will also depend on strengthening community engagement and participation in vaccination efforts, ensuring that trust, awareness, and access are reinforced at every level of society. I'm so honored to be able to launch Vaccination Week in the Americas 2026 in the sub-region of the Caribbean. And as we do so, I ask that we move forward with a shared commitment grounded in evidence, strengthened by partnership, and guided by the recognition that our individual and collective decisions shape the health of our Caribbean people. Thank you for your attention.
Thank you very much for your remarks, Dr. Seeley Thomas. And allow me the pleasure to introduce the next speaker, who is no stranger to any of us in this room. But I must say that the Minister of Health, Dr. Frank Anthony, is a true public health warrior, not just for vaccines, but all of the areas. And I can bet you 100% that he will tell you about his passion for cervical cancer elimination in Guyana. And the basis for that is vaccination. Please welcome Dr. Frank Anthony.
Thank you very much, Dr. Hamilton. Let me also join in once again welcoming Dr. Seeley Thomas, the Assistant Director of PAHO, Dr. Kim Dixon, the PAHO representative here in Guyana, Ms. Helen Royer from CARICOM, our colleague from Barbados, Dr. Brooms, all the other staff of PAHO, friends from the UN, Chief Education Officer, Mr. Saddam Hussein, and all the students who took time off to be here with us this morning. We are very pleased to have so many of you, and this, as you heard, is a very important exercise because we want to ensure that our population is protected, and one way that we can protect our population is to ensure that they're adequately vaccinated. But this is a challenge in these days because we have seen that vaccination rates post-COVID got affected. And there are lots of misinformation that people peddle around depending about vaccines. And if we allow the misinformation to persist, then it would harm how we are able to roll out vaccines, not just in Guyana, but across the country. And so while we focus on getting vaccines to people, we also have, more importantly, to combat this misinformation that is often peddled about vaccine. And that's something all of us have to do. Because it's easy now to go on the internet and you have some expert, so-called expert, who would be talking all kinds of things about vaccines. I remember during COVID, we had one of the stations at the Ministry of Health where we were doing vaccination. And an elderly couple came to the ministry, and the lady was basically saying to me, I came here because I want a letter of exemption that I shouldn't take this vaccine. And whenever I travel or wherever I have to go, I can present this letter of exemption. So I said, why do you think you need this letter of exemption? She said, because I don't think this is a good vaccine. and she started regurgitating a whole set of misinformation. And I said to her, well, sorry, I can't give you a letter of exemption because from all the things that you were telling me there, none of them are really true. And given your age and given your state with a lot of chronic non-communicable diseases, it is more important for you to be vaccinated rather than not to be vaccinated. So the gentleman next to her was standing and he's listening, and he said, so I said, well, you know, it's one thing to talk to people who have expertise in the field and who would have spent a long time, you know, training, learning of the science behind vaccines, and they're able to explain why they're giving it to you. And it's another thing to listen perhaps to some school dropout who is on the internet pontificating why this thing is not good. I said, who would you believe? So the gentleman said to me, as I turned to walk away, he said to me, excuse me, Doc, come back, come back. So I said, what happened? He said, which one of the vaccine you took? So I told him. He said, all right, I can take the same one. So he went on and he, you know, I called one of the nurses and they gave him the vaccine and he was very happy. His sister, the lady that came for the exemption, she was very unhappy. But I think, you know, when you start talking to people, they get it. And that's what we need to do. We need to spend a little bit of time explaining to people why this is absolutely important. In Guyana, we have made significant strides in doing vaccination. You saw from the film that we're doing 21 antigens, and that has really expanded the amount of antigens that we give here. But we have seen the benefits of that. We have seen that we don't see the kinds of illnesses now, despite whatever season might be passing, you don't see people getting sick because they have been immunized. And that is very important. And I think that's how it's a very wise investment. But for us to be able to do this on scale, and the scale that we have been doing it here in Guyana, requires a number of ingredients. So first of all, we have to ensure that we can get an affordable source of vaccines. And that's where PAHO comes in, because for all these years, we have turned to PAHO and we have been able to get a reliable supply of vaccines. And they give us the vaccine, we bring it in, and then we are able to give it to our population. So we are very thankful for the collaboration with PAHO in ensuring that we have constant supply of all the vaccines that we need to deliver to the people of Guyana. So please give PAHO a big round of applause. Over the years too, we have worked very closely with UNICEF. So with vaccines, there's something called a cold chain. And cold chain means that you have to have all these refrigerators strategically placed across the country. And then when you're moving from these hubs that we have and taking it out into the field, you have to get the right container to transport the vaccines. And so that's something that we decided we want to invest in, because we thought that having some strategic points, not just in Georgetown, but across the country where we can have cold chain hubs, would be a worthwhile investment. And so I think around 2022, 2023, we put a lot of resources in building out these hubs. And then of course we start ensuring that for the last mile, we have all the refrigerated or the ice boxes that are necessary to take vaccines out into the field. We also did an assessment. You know, we have about 450 or so facilities that we operate in the public sector. And we did an assessment to see how many of them had refrigerators. And you know, in the interior, it's a challenge sometimes with electricity. So we have been giving many of these health centers in the interior solar refrigerators. And that has been very helpful. And so that has really helped to extend the program and to make sure that people can be vaccinated. You know, these things we have to learn maybe from our experiences. So again, going back to COVID, we had sent in a team to Guns. That's right down at the bottom of Guyana. And they went there with about 300 doses of vaccines to give to the population of Guns. They had about 300 people who were living there. And when they came in, they flew in. You have to walk about a mile away from the airstrip to get to the village. And they got there, and the plane took off to go do its work, to come back to pick them up. So they got into the village, it started to rain, and then the plane couldn't come back because now the place is very soggy. And so they were trying to talk to the people there about vaccines. I think of the 300, maybe about 10 or 15 people took the vaccine. And then the whole team got stuck. And they were there for about 9 days, I think, because the conditions were not safe for the plane to come back. And the village did not have a refrigerator. So the rest of the COVID vaccine spoiled. And, you know, that was a lesson, because at the time, those vaccines were like, I don't know, more precious than gold, because people wanted them. We had them in scarce capacity, right? So we wanted to make sure that people can get them. And so the rest of the vaccine got spoiled because we didn't have a refrigerator on site. So one of the things that we did there, for example, we rebuilt the whole health post. We added the solar panels, give them a solar refrigerator. We put in telemedicine so we can talk to them, know what's going on, and give them all these internet-enabled devices. And I remember going up there to Guns to open this facility, and the head of the village, Tushao, he said to me, "Minister, we got our small hospital here." So he was very proud of the changes. But again, the challenge here is if you don't have refrigerators, then it can impact on storage and delivery of these vaccines, and you can get a lot of spoilage. So we have invested in getting out the cold storage and building that network. And we have seen that that has paid dividend. So the other challenge that we've had is how do we make sure that our healthcare workers are properly trained so that they can continue this journey and make sure that everyone in the community who's eligible can get these vaccines. And so from time to time, we do a lot of training. We go out into the regions, we work with people, and I keep complaining sometimes to Dr. Hamilton that, you know, it seems like we're retraining and training and retraining and training, and, you know, why are we doing that? By now, the people should know. But they keep insisting to me that it is absolutely necessary to reinforce what people have learned. And sometimes, you know, when you think you know the thing, you get a little bit too casual with what you're doing. And sometimes you take shortcuts, and they go out to monitor to ensure that people are doing what they're supposed to do and make sure that every child can get these vaccines. Because it makes no sense, you know. If you have the vaccine and it's nicely stored in a fridge, then it's not working for anybody. You got to put it in somebody's arm so that it can work to protect that person. And that is extremely important. So we need to do more work in ensuring that we meet the last mile. I've asked Dr. Hamilton for the stats dealing with the different antigens that we do give out. And I can see that they've really tried very hard. So most of our antigens, with the exception of one, most of them are more than 95. And in fact, they're at 98 and 100%. So I think they deserve a big round of applause. last year we had one antigen that was in the 80s. And when we had the internal discussions in the ministry, they told me, not last year, in 2024, they told me that they are going to take that up into the 90s. So they kept their promise. It's at 91% right now, but that's not our standard. So we have to take it up beyond the 95%. So I expect that we'll work very hard to take it to the 95%, right? Right. So I think we'll get there, because that was one of the vaccines that was affected during COVID, and we're now in that period of trying to recover and make sure that we get back up to the 95%. Another area that we have focused on is in the area of cervical cancer. And like Dr. Seeley Thomas would have said, this is a disease that we can actually eliminate, because most of the cancers are caused by viruses, the human papilloma virus. And if you get a vaccine, then you can prevent this from developing. So we have, over the last, I would say, 2 years or so, we have had a very strong focus on getting children between 9 and 15 vaccinated, both boys and girls. And we have been pushing this campaign repeatedly, and in a lot of our public pronouncements, we keep talking about it to get people sensitized about the importance of this. And why that is important, it's because we are seeing from our national statistics that among women in Guyana, the two main cancers, the number one is breast cancer, and number two is cervical cancer. But cervical cancer, we can eliminate it. Nobody in this country needs to die from cervical cancer if we give them the vaccine. And so that's something that we've been working on. And I think over the last year, we would have been able to do about 26,000 doses. Our coverage right now has moved up steeply. We are now at 69% across the country. And according to PAHO WHO, if we are aiming for elimination, we have to take the coverage up to about 90% and keep it there consistently for a number of years, so that everybody in the population would then be covered. So we want to make this happen, because we can protect people from dying from cervical cancer. And I know when you say cancer, people get scared, but here is a vaccine that can prevent that from happening. But we have gone beyond this 9 to 15 age group. We have also opened up the vaccination based on international guidance for women between 16 and 45. And so you can get doses during this period, and it's also protective. All the scientific studies have said that this is very protective. So those of you who are within the age, please make sure you go and get your HPV vaccine. And there's an additional bonus. You know, a lot of you know about the 100,000 cash grant, right? Everybody know about that? Huh? Yeah. I think the audience sleep away. So we have started this 100,000 cash grant, and we have been giving it away. But did you realize that for HPV vaccine, the one that we are using now, the 9-valent, you know what that costs? That's $360 US per dose. That's a lot of money. You don't think so? $360 US per dose. But because of PAHO and the company that we've been working with, that's how we were able to access this vaccine. So sometimes when we make these things very easy, people don't understand the value that they're getting. most countries around the region are not able to afford to give their population this type of vaccine. But you have it here in Guyana. And we're still seeing maybe little pockets of resistance. So please, you are getting the best vaccine that is on the market right now. The best one. And therefore, we shouldn't see hesitation in using it. I know people before we introduced this vaccine, some people who could have afforded it would have traveled from here to go to North America to get the vaccine. Now you have it right here. There's no excuse. And we are not limiting this vaccine just to coastlanders. We want this vaccine to be across this country so that every single person who is eligible can have access to it. The only barrier right now is to make sure that we get the children out, get the women between 16 and 45 to come and get the vaccine. So I hope that during this month, that we spend enough time to get people out, sensitize them, bring them out, and make sure that by the end of this month, we'll be able to not just do 26,000, but I'm looking for at least 60,000 people being vaccinated.
Of course.
I hear Dr. Hamilton say, of course. Why 60,000? Anybody can guess? So on the 26th of May, we'll be 60th. It's our 60th independence anniversary, right? So what a better way of celebrating by ensuring that we can at least have 60,000 Guyanese getting HPV vaccines. Can we do that? So we have some work to do, right? So apart from what we have been doing on the vaccination side too, we have also introduced a voucher, a HPV voucher, that we distribute very widely, and it's for women to get those vouchers and they can do an HPV test. Now we know sometimes people don't want to come to the public facilities, but you can take those vouchers and go to the private institutions that are working with us. And you go there, you present the voucher, they'll do the test for you. We'll get back the results. If we see that you're HPV positive, we can bring you into the system, work with you to make sure that we can help to detect early and fix any problems that you might have early. By doing that, what we're trying to do is if there's any changes in the cervix, we detect it, we fix it, so that you don't necessarily have to develop cervical cancer. And that's how we believe that we can prevent this. And if we find that anybody got early signs of cervical cancer, then we can take the necessary steps at any one of our hospitals to prevent that from spreading. So catching it early would help people to survive. And that's how we are approaching this whole thing about how do we reduce the burden of cervical cancer. We must make this move from the second most prevalent cancer among women to almost getting it to disappear from our country. And I really believe that that's possible. What it takes is systematic approach, hard work, get a lot of public education out there, and make sure that people utilize the service. If they utilize the service, then we can change the course of this disease and people would live longer. Think about that. We'll probably be able to save every year maybe about 200 lives just by this intervention alone. And so I think as we think about vaccination week, there's still a lot of work, maybe in specific areas that we have to do, but you know, we have to do it because it would impact on the well-being of the people of the country. And I will say too that whatever we are doing here can also, for those countries in the sub-region that haven't introduced some of these programs as yet, you can always borrow the experience that we have and learn from what we've been doing, so that when you plan to introduce in your communities, that you can take these experiences. And we have, over the years, developed a lot of expertise here. You saw the awardees who were able to give a little plaque in recognition of their service. Between the 6 people that we honor here this morning, think about that, 264 years of service that they have given to this country. I think they deserve another round of applause. We have people who have really dedicated their whole life to serving people. And sometimes they do it without thinking about it. And a lot of times they go unappreciated. So ceremonies like this remind us of these types of resilient people that we've had in the system, whose work has really helped to make this program a success. It is not accidental or coincidental that we have had these successes. It is because of the dedication of workers such as the 6 awardees and many more across the system who would have instilled these values of ensuring that we go and we reach every child wherever they're located to make sure that they get that vaccine. A lot of times when we're doing the map-up campaigns, they have to go for miles. And our terrain is not among the easiest terrain that we have in this country. Our terrain, you gotta go up mountains, you gotta go through rivers, maybe walk through jungle, meet some snakes and so forth, but we still go, right? We go because we have a mission, and that mission is to ensure that every child get their vaccine. And they've been doing a splendid job. So for all the community health workers, nurses, and everyone, MedExes and so forth, everyone who has been working on this program that would have bring us all this success of getting our antigens at more than 95%. I want to say congratulations to all of you. You are really and truly the backbone of the system. Please give yourselves a big round of applause. And to our partners and collaborators, without you, this would have been extremely difficult, especially with PAHO. Apart from getting vaccines from you, you've lent us a lot of technical expertise that would have helped us to, over the years, to strengthen our program. And while we work and we feel proud of what we have achieved, we know that there are always room for improvement. So we are constantly working and innovating and see how we can do better. So I think with that continuous process, it would help to even to lift the standards further. And with some of the other innovations that we're putting in other side of health, like telemedicine and some of the other things that we are doing using technology, I think it would be mutually reinforcing in terms of vaccination. And as we improve our primary healthcare system, I think you will see how this would impact people. We have right now a very strong, I would say, school program, and we have partnered closely with the Ministry of Education in rolling this program out. Because of their assistance, we are probably now covering about 90,000 school children across this country. And vaccination is one of the things that we're looking at to make sure that people are properly vaccinated. But it's not only in the children population. We also want to protect our older population. And that was why we have introduced the influenza vaccine. And we have about 10 sentinel sites where we look at what are the types of influenza viruses that are circulating. We can do the sequencing for the virus, and so we can understand the genetic makeup. And the last vaccine that was done, that we used last year, we actually, the samples that were collected here, the viruses that were collected here, were used to develop the vaccine that was used in our population here. So that's good science, because we are now using what is circulating, developing vaccines that can actually have an impact on the viruses that are circulating in our population. And again, we want to thank PAHO and WHO for working with us closely on these areas. So lots of good things, and we want to continue to work. Again, I want to thank the leadership of this program. It has been one of the strongest programs in the Ministry of Health. And I remember many years ago, I think around before 2015, or no, much more earlier than that, I think around 2000, that for one of the programs that we were running in vaccination, we actually had sent a team to Paris because they won a gold medal. So this program has been an award-winning program, and we are extremely proud of this program. So congratulations. You have a rich tradition. Let's build on it and make sure that we miss no arm to give a vaccine to. Thank you.
Thank you very much, Dr. Frank Anthony. I think we have a full understanding of where vaccination is going in Guyana and the rich history and the partnerships that have brought us to this point. And I'm very certain that Dr. Scott and her team will ensure that there's no arm that is missed that can be vaccinated. So with that, we ask Dr. Scott to deliver the vote of thanks as we come to the closing of this activity.
Parting is indeed such sweet sorrow, especially in a moment where we are all...
Sorry to disturb Dr. Scott, but I would like to announce that Dr. Scott and Dr. Frank Anthony were awarded the prize from the CARFA conference for the best paper on policy.
Thank you, Dr. Hamilton. So going back to my moment of pride, one that we all want to bask in just a little bit longer. Parting is indeed such sweet sorrow from this event. But at the beginning, when we established the protocols under which this forum would be conducted, I forgot to mention one important group. Joining us from across the Caribbean, PAHO TV Live, are members of the public and leaders in all the Caribbean countries. And we need to give them a round of applause. So as I was sitting there, one of the most fervent EPI managers, Risa from Turks and Caicos, shouted me out and said, "Why are you on your phone?" And then another from Dominica said, "Hello, Unika, you look okay." We have throughout the immunization community a strong family, locally, internationally, and in our Caribbean region. We are exceptional in the work that we do. But to the vote of thanks, starting off from where the minister finished, I am going to start with the government of Guyana, represented by our Minister of Health today. This government has historically and in present day shown unwavering political leadership and bold investment in health and anything vaccines and immunization. We just have to say it. We have to defend it because they like to hear Dr. Hamilton speak, but we don't really have to defend it. Minister, you have championed this cause, defending it to your cabinet colleagues. You have supported with leadership that is genuine, with leadership that is corresponding with leadership recognized throughout the Caribbean. Because of your vision and leadership, Guyana today stands as a beacon in the Caribbean, boasting of one of the most comprehensive vaccine programs supported by strong policy. In Guyana, we're not afraid to put anything on paper. We take it to legislation if needed. We led when we introduced PCV 13 in 2020. We led a region. We were the first to not just introduce the HPV-9, but advocate for it in 2023. And at that time, we couldn't get it. But we are also the first in the region to really represent equity in expanding the HPV vaccines to boys in 2019. Our government has shown exemplary political leadership that today makes me proud to be Guyanese and makes you all proud to be part of a region led by a strong nation. These are not just milestones, however. The government has shown statements of intent. They clearly show that in Guyana, prevention is not optional. It's the way we save money while we save lives. And the results speak for themselves. The return on the investment in vaccines made in Guyana is exemplary. We have a moment to smile all the way for the rest of the month while we vaccinate, while we reach every family, every child, every adult who in our armory will be able to benefit from one antigen or another that we carry. To our regional and international partners, CARICOM, PAHO, UNICEF, and our sister countries present here today, Trinidad and Tobago, Suriname, Barbados, thank you for standing shoulder to shoulder with Guyana. Borders, no boundaries. You have not just taken a seat at the table in immunization, but you have helped us lead. You have led yourselves. Together, we have strengthened our advocacy, ensuring that the Caribbean stands exceptional when compared to the other regions of WHO. North America, nothing on the Caribbean when it comes to vaccine. To Dr. Karen Broom, who keeps reminding us that her name is Broom, not Brooms. Allow me this personal note. Guyana thanks you. Thank you for your guidance, your wisdom, and yes, that gentle but ever-present whip that keeps all of us on our toes, all of the EPI managers across the Caribbean. Your open door policy has meant that even at the oddest hours, your surveillance nurses in Guyana, Nurse Trim, Nurse Griffith, Nurse Jonas, and Nurse Mason, who was honored here today, can reach you. And that's really what matters in immunization. No red tape, no red tapes. Because we know the vaccination program will suffer without strong surveillance, we understand the importance of your leadership, always advocating that along with high immunization coverage, we meet high EPI surveillance indicators. Without a strong surveillance program in immunization, that's like cooking without tasting. Something might be missing, and we may not realize until it's too late. Immunization does not end with the needle, as Dr. Broom regularly tells us. It lives in our vigilance, in the active and passive surveillance that protects our hard-earned gains, ensuring that diseases like polio and measles remain eliminated and not reintroduced in our region. To our regional immunization managers and leaders in Guyana, in Jamaica, in Montserrat, in St. Lucia, in Trinidad, in Turks and Caicos, oh, there's so many, and I know you're listening, but it will take me a while to call all of you. We at the Ministry of Health Guyana thanks you for your cooperation. To our leaders in Guyana, Region 1 to Region 10, we thank you for your patience. We know that we can be demanding, and that's me choosing a very polite word when it comes to managing the immunization program. But the leaders we have in our 10 administrative region forever rise to the occasion every single time. Every time we plan a campaign, every time we demand data, every time we demand reporting, every time we change our communication strategy. We could not do it without you at the Ministry of Health. The minister could not do this without you at the Ministry of Health. With excellence you serve, and we recognize this with humility. We are indeed grateful. To the Ministry of Education, our CEO, and your entire team here today. Mr. Hussein, I hope you know by now, we ain't going nowhere. HPV vaccination is here to stay, and I'm happy that the Ministry of Education has embraced that. You have exemplary teachers who have recognized the growing nature of vaccine misinformation and disinformation, and teachers across the region have joined forces with the healthcare workers championing the debunking of myths related to the HPV vaccine. Today, as we launch our first biannual HPV vaccine campaign, we thank you for opening your doors at the Ministry of Education, because we, however, want this vaccine to be delivered at the facilities. We bid you to bid your parents and your teachers to have children come into the facilities as well when we miss them in the classroom. We are happy that the Ministry of Education has held our hand, walking forward to deliver HPV vaccine. The next campaign, we hope that we will be here again launching. And finally, to the people of Guyana who've created a proud culture of immunization across all sectors of the life cycle, from adolescent, childhood, adolescent to adulthood. We thank you. This program is an eternal success because of you. Your trust in the work that we do at the Ministries of Education and Health is exemplary. Your participation as a nation with a high vaccine culture stands as an example to the other regions of the world, and it impacts where our nation is in preventative medicine greatly. As we bring this session to a close, we must be proud that Guyana has represented equity in vaccination, that whether a child is in the hinterland region or on the coastland region, we will find them. We will advocate for them. We will not turn our backs on them when for some reason misinformation prevents that barrier or causes a barrier rather to vaccination. We will come again and we will give the information that's necessary. On behalf of the Ministry of Health, PAHO, and UNICEF, we thank you all for being here today.
Thank you very much, Dr. Scott, and thank you everyone for being here. With that, we have come to the end of the program, and refreshments are available. Thank you, and do have a blessed and wonderful weekend, and an exciting Vaccination Week 2026. Please feel free to visit the bar at the side of the room. Can we have the awardees please come to the front? Can we have the awardees please come to the front? Thank you.
You want them up?
As always, bringing the vibes. No, really, this is very important. I think one of the things that always happens is we tend to think, oh, this is our sector, this is beyond us. Anyway, take care, enjoy. Thank you for coming.
Awardees, we're asking for your presence on stage. Thank you.